To explore the eye exposome, I have with me Dr. Preethi Naveen, ophthalmologist and cornea and refractive surgeon, to talk to us about what all the eye gets exposed to and what you and I can do to protect the eye just a little better. The Q-tip alone, can you see? Because it has to be on the hair.
Yeah, if you've done the washing and the lubricants and it doesn't go away, you can wet a Q-tip, lower your lid, see where the follicle is there, just press on that, it will come out. When you apply a kajal or an eyeliner or something very close to the waterline, so when you look at yourself in the mirror and lower your lid, you could actually see those openings there.
I can never use mascara primarily because my eyes are too small, and when I do use mascaras it kind of gets stuck to each other. For people who use it very regularly or probably using it in a much better way than I am, how do they get it off?
I would say maybe use...
Can you tell us, are we as a country more prone to cataract, occurrence of cataract because of sun exposure, and sunglasses help?
That doesn't mean that I wear sunglasses and I will never get cataract. That is not going to happen.
Twitching of the eyes, is it a good omen or a bad omen?
There's definitely...
Is it okay to look at the solar eclipse directly? Is it okay to apply kajal to newborn babies?
I wouldn't advise anything.
High number of people coming in with a difficulty to see like they usually should do or could do, be it in the youngsters, be it in an older age. What do you see as external or lifestyle factors that contribute to it?
I think the most common thing nowadays is
understanding and exploring the exposome science, which is basically the sum total of all of the exposures in the outside world which interact with our genome to give us certain outcomes, has been a fascinating journey for me. Maybe because it's about dermatology where the skin is exposed and you can easily understand that there is an exposure that's happening, there is an outcome that's happening, a cause effect that we can see. Maybe because of that, I'm deeply attracted to this. You've heard a lot about the exposome effect in dermatology from me, but here I would like to take it a little further by inviting experts from other specialties to talk about this exposome effect and see how it plays out in their respective domains. To explore the eye exposome, I have with me Dr. Preethi Naveen, ophthalmologist and cornea and refractive surgeon, to talk to us about what all the eye gets exposed to and what you and I can do to protect the eye just a little better. Welcome, Dr. Preethi. Pleasure to have you here.
it's a pleasure to be on your show, Renita.
The first ever thing that I want to ask you, we speak a lot about skincare routines. We speak about, I think you've heard millions of reels talking about the best way or the right way to do skincare. Do your patients come to you and ask you for an eye care routine ever? And if yes or no, what is the eye care routine that you recommend?
So like you mentioned, there is a lot on Instagram about dermatology and skincare, but unfortunately there's very little content on eye care. And honestly, I don't have any patient coming up to me and asking me how do I take care of my eyes.
We go to you only when we have a problem.
Yes, they come to me only with a problem. When all the damage is done, they come to us. Okay, so it's a good question to start off with. So if you're talking about eye care, I have patients coming to me telling that I splash water into my eyes every day morning as a ritual.
I believe that a face wash doesn't feel as
Complete.
Good. You need to have evidence of you having washed the face. Like my family knows when I have washed my face.
Okay. So
that's not okay.
No, that's
Absolutely.
not okay.
Okay.
It's okay to wash your face, but again, like you say, gentle cleansers, and you have millions of cleansers for your face. We don't suggest anything specific for the eye. Like while you wake up in the morning, sometimes you notice this crusty particle at the edge of your eyelid, and we all have this tendency to keep rubbing it off. Yeah. So that's basically the debris from the night. You're sleeping the whole night and there's debris secreted. So during the day, you're blinking and it just comes out of your eye. But during nights, your eyes are closed, so they accumulate at the corners of your eye. So you can just wipe them off with water. And I wouldn't advise using tap water to splash into your eyes because it has its own set of contaminants. We don't want you getting an infection because of that.
My family is going to be very happy to know this, that they will not require to wipe down the entire...
Yes, you don't need to. And a lot of them say they put their eyes into a bowl and open their eyes into water, open and close.
We should talk then about the ice dunk
Yes.
myth also, the ice dunk non-real, the ice dunk non-trend as well.
Yes, we should do that. The ice dunk, I don't know how effective it is for the skincare, but if you're doing it, please close your eyes when you dunk them into the ice. I don't want any water getting into your eyes. It's not going to make your eyes moist. It's just going to make it more dry. You have a natural mechanism for tear production, and I don't think you need to add on water into it artificially.
You said that for our eyes, the secretions are perfectly normal. So, but for kids, do we initiate an active cleaning plan, or is it the regular face wash should do? Is there anything specific to do for kids, newborns, babies?
So babies and newborns, typically, you have something called as a nasolacrimal duct through which the tears drain from your eye through your nose. So that is not fully open or formed in babies. So that is why most of the kids, you see them with a lot of secretion. So we teach them this massage, which is called as a Krigler's massage. So from inside, the mother typically does it with no nails in your fingers, obviously, and you massage from inside towards the duct. So you're trying to open the passage to allow the secretion to go out. But if you were to clean, then I would say maybe a clean cotton cloth. Don't use cotton as such, because it has those fibers which tend to get into the eye. So use a clean cloth with warm water and you can wipe the baby's eye.
Right. There's no specific technique that's required, because if at all, if I did see an eye care reel, I saw it for babies, and there was a whole lot of products that were dropped literally into the eyes and expecting it to be cleansed out. It's an absolute no.
Nothing at all. Absolutely not.
Speaking about what we apply on our eyes, I'd like to ask you about eyeliners and kajal. I do not know if you remember this pic that I think I sent you a couple of years ago, where I had tried on a new product with a little bit more waxy, long hold product, but ended up, I think, infecting my meibomian glands, and then it spread to almost involve to give me a full face, like a half face swelling. What did I do wrong?
So what went wrong there was typically one is a new product which you're trying. So I tell most of my patients, try to stick on to products which you're familiar with, or go at a slow pace when you're trying new products. And so when you look at the structure of the eye, you have glands which are situated along your eyelid margin. And the glands are very important because they secrete one portion of your tear film, which is called as a lipid layer, and which prevents the tear film from evaporating faster. So by doing this, when you apply a kajal or an eyeliner or something very close to the waterline, the waterline is a place where these glands open up. So when you look at yourself in the mirror and lower your lid, you could actually see those openings there. And when you press on them, you see an oily fluid come out of it. So it has to be a clear oily liquid. And when it is blocked because of this continuous use of makeup products and not cleaning them off properly, then it causes an infection. And what you had probably was a stye, and it's nothing but a bacterial infection of the lash follicle which is there. And if you notice the skin around the eye, it's very lax, and that's why when you hit yourself or something, it swells up very easily because
much like the lip.
Exactly. So what happens is, if the infection, usually it subsides with warm compress and just an anti-inflammatory, it goes down. But in some patients, what happens, it spreads into that preseptal space. So that is why you had this, almost half of your face getting involved with it, which doesn't happen very often in most patients. They just come with a stye, just warm compress, and it goes away. We tell them, like pimples on your face, you tell them not to pick. We tell them not to touch the swelling on the eye, because you're again infecting it with organisms from your hand. You're only worsening the process, and they feel that if you pull out that lash, everything is going to be fine. But please do it under the supervision of an ophthalmologist. Let us do the job, and don't self-medicate and do things which you see on Instagram. It really doesn't help.
The first sensation, I think, if I remember right, when I started off, I felt like there was a gritty sensation or sand in my eye. Is that a good time to come meet you? Is that a good time to get it evaluated by the ophthalmologist?
So a gritty sensation comes because of a lot of things. Most common is dry eyes, or if you've had some foreign body enter your eye. But it is an indication that something's going to happen there. Not that for every gritty sensation you have to walk in to us. It's because you'll be having it throughout the day multiple times. So not that. But if you're developing a stye, then you'll notice is a dull ache, or a small boil developing over your lid. And if that starts, first and foremost, start with your warm compress at home. And maybe in a day or two, if it doesn't subside, then you can visit the ophthalmologist.
You spoke about a gritty sensation, and you said, okay, sometimes it's okay to feel that when the eyes are dry, but sometimes if you have a foreign body or something that falls into the eye, is it okay for us to, because you said you don't need to go to the ophthalmologist for every gritty sensation, is it okay for us to try and remove because putting your eyes into a cup of water, trying to blink, all of that happens only when this foreign body has fallen into the eye, and
from outside, if you felt there was a dust particle in your eye, or maybe if you feel there's a lash follicle in your eye, you can try washing it off with clean water. Okay.
would we say mineral bottled water is safer?
Bottled water is
Not
safer.
tap water.
Not tap water. Use bottled water. Try to splash away the foreign body, or so-called, if you think there's something in your eye. And even after multiple attempts of washing your eyes by yourselves, if you still feel the gritty sensation is persisting, then I would say if you have a lubricant at hand, you could try using the lubricant, because it tends to wash away whatever is a little deeper. I wouldn't suggest for jump in and try to take out the particle by yourself. Try your maximum to bring it out by itself. But if you can visibly see a lash follicle on the white portion of your eye, which is your conjunctiva, if you see a hair follicle there and you know that is what is causing the grittiness, you can go ahead and try to remove it if it's not coming off by itself. So again, wash your hands well, because you're going to put your finger inside. And if your hand is...
Hand sanitizer or soap and water?
No sanitizers, just water. Sanitizers again sting when you put them into your eyes, so no sanitizers. Just wash your hands with clean soap and water and try to see if you can pick on that lash and take it out. If that is not happening, if you have a Q-tip at home, moisten it or put a drop of lubricant or something on that, and then try to place it over the lash follicle and take it out. Again, I don't want you rubbing and creating damage there. Only if you can take it out carefully, please do it. Otherwise, just rush to the doctor.
The thing I also hear is that there needs to be a unit or a bottle of eye drops at home.
Okay.
Is it something that you would recommend keeping at home, much like a hand sanitizer or an antiseptic, or
so
would you...
for eye drops, I would say definitely keep a bottle of lubricant with you, because given
Every household?
every household,
Like a thermometer?
Yes.
Okay.
Please
That is
keep
new.
please keep a lubricant eye bottle with you, because in the middle of the night, there are different conditions which kind of flare up, and you're not able to reach the doctor immediately, and you need something for your eye care. Then lubricants are the first line of treatment, I would tell. They're pretty safe. It's not an antibiotic, it's not a steroid, so you don't need to worry too much about it. It's more like you're moisturizing the surface, you're flushing out whatever is there, and it gives you soothing relief. So please keep a bottle of lubricant, and you can take it over the counter, so it's not a big deal.
What do these contain typically?
So mostly they have sodium hyaluronate, HPMC, CMC polymers. So they're different lubricants.
Cellulose-based polymers.
Yes.
Okay.
So different lubricants have different compositions. So when you go to a doctor, we prescribe a particular lubricant based on your need. Like if you need it, the lubricant to stay a little longer, then it's a different combination. But you could get anything, a CMC-based lubricant over there, and just for a temporary, it's like a stopgap solution. Yeah. Not that you put lubricants and stay at home and not visit us.
Of course. It's something that will tide us over till we get to you.
Yes.
And generally, when you open a bottle of lubricant, you're supposed to finish it, or any eye drops or eye ointments, you're supposed to finish it within a month.
Yes.
Why is that rule? And what are we doing wrong that these things have to be finished up within a month?
So one is... most of the medications have preservatives in them. There's some of them which are preservative free, and what happens is with lubricants, I've seen most of the patients are not lubricants, or any drop for that matter, they're not very hygienic about how they close the bottle, they touch the tip, and when you put the drop and you close it without touching the tip of the bottle. So when you touch the tip, again, you're contaminating the tip over there and you're using it. So it's not that you have to finish it within 1 month. It's like something which you tell patients that once you open a bottle, at least note down the date of opening, because if I'm using a lubricant, I have dryness today, something fell, I'm using a lubricant, I open it, put it away, and then after 2 months I feel I could use the same drop again, because I don't know what's gotten into the bottle and if that is going to cause me an infection. So typically note down the date of opening and finish it within a month. It's more for hygiene purpose and not getting an infection.
This applies to all eye drops, eye ointments, everything. Even the ones that people use for long-term eye conditions.
Everything. So if you're on those medications for a long term, you're probably following it and you don't have to number it and date it, because it will get done within a month.
What is your take on lash extensions?
So like I told you, lash extensions and all these products, people come to us only when there is a problem.
Yes. They get it done at the salon, they get it at the parlor, they would, because it's they hear about it through friends or it's trending, and I think
Exactly.
you get to hear, you get to face, or you get to help people
Only when
who
it
are,
doesn't come off and they have an issue, that's when we see them.
yeah.
So lash extensions, like I told you, we don't, ophthalmologists, we don't do it. But wherever you're getting it done, if it's a reputed place and you're sure of the products they use and everything, and if it's done well, then it's great. But the only problem with lash extensions is I think it stays for a period of 6 to 8 weeks, if I'm correct.
Best case scenario.
Okay. So they fix it with a glue, right? Maybe a cyanoacrylate glue
Yes.
or different types of glues. So we typically in medicine, we use this cyanoacrylate glue to seal tears, right?
Yes.
So if it is done under supervision, it's a great product. But the glue which they use, or the adhesive they use on the lashes, accidentally falling into the eye and, shutting your lids together, because it is a strong
you have seen
glue.
such things.
Yeah, we have seen. We've seen, actually, I have seen even kids play with Fevicol and they come with both their lids stuck.
Okay.
So, and with these lash extensions, we've seen some of them and over a period of time, because of the lash extensions, there is a drooping of the lids because it's heavy. The extra extensions are making your lids heavy. So there's a little droop there. And second is, because the extensions are there, they don't tend to clean that area they don't even touch that area, I feel, till the extensions are out. They're trying to be very protective over there. And like I told you, every day the eyes are secreting muck which has to come out, and if there's no way that you can clean it, it's going to accumulate at the base of your lash. And then what happens, these particles enter into your eye and they cause this constant irritation, watering, foreign body sensation, grittiness, and the entire thing. So if you can handle it well and maintain it clean and do it properly, then maybe it's an option.
I usually say if you are doing it ahead of an event,
Yeah.
it's probably okay, but
Yeah.
it's not a great practice if people actually do it every 2 months and they do an upkeep and a maintenance and continue to do it after. It's like the eyes can tolerate strain for a little bit of time, the skin can tolerate strain for a little bit of time, but when we constantly keep loading it, that's when the breakdown typically happens. Now, you mentioned about cyanoacrylate glue, and also it's interesting that you brought up Fevicol, because Feviquick or the quick fixes are the ones that have the cyanoacrylate glue. The regular fake lashes are usually fixed with some other kind of gum that is water soluble, so you
Okay.
basically can wash it off.
Okay.
The constant makeup, the fake lashes that people use in makeup, that can be washed off when you soak it and then you wash it off and you can remove it. But with cyanoacrylate glue, it goes away when it goes away. So the problem is that that's also a formaldehyde releasing agent. So you are putting in a whole lot
Exactly,
of
into your
exposome,
eye.
damaging exposome factors too close to a precious organ. What is the worst horror story that you have when it comes to these fake lashes or lash extensions?
So one is if the glue gets onto your cornea. So that's the part which is transparent through which light enters your eye.
We see it as black, but it's transparent.
Yes, it is transparent. So when I talk about cornea, they say it's a black portion of the eye.
Yeah.
So there is no black portion in the eye. You have something called as an iris through which, and you have a central opening called as a pupil through which light enters. And then there is a dome-shaped structure. So there is a depth over there. It's not flat. It's like a dome. So the cornea is transparent through which light enters. I would say the nerve supply is extensive there, and that's why if there is even a small scratch on the cornea, you have excruciating pain. So,
Okay.
if this glue is stuck there and you will have to peel it off from there, then you're peeling off the top layer of your cornea. So once I peel the top layer, I'm exposing the nerves. And then they have pain, watering, discomfort, and everything. So I'll have to put them on a bandage contact lens to, tide over the epithelium healing. And it takes a week for that layer to grow back. So until then, they'll be on contact lenses. So that is something which
Has
we
this
don't
progressed to? Has this ever progressed to anything very?
Infections can happen, yeah, because you are on, you have some foreign body on your cornea, you're getting it removed, and in the process, you're peeling off the epithelium there, and it's an open zone there for infections to happen. And if that happens, then it's, you're spiraling down, so that's
But you must have heard
scary.
of many other lash stuck together incidents. That is normal.
Yeah. The lash sticking is actually the simplest of all, I would say. We can just take it off and cleanse it properly. So that's something we can still handle. The lash sticking and not coming off is, I would say, is the easiest to handle. But if it goes into your eye and onto your cornea, then it's a problem.
Look, a quick word about lash lifting and lash tinting.
So in this, I think the tinting, they probably use a dye over there.
Paraffin dyes, which we think is not a good idea.
Okay.
But for the lifting...
And for the lifting also, see, the more your eyes are semi-closed, I think it keeps the moisture more inside and retains it for a longer time. So when you're lifting it and opening it and creating a wider aperture, there's more chances for evaporation there. And also the chemicals used there, the products used, they can cause irritations, allergies, and like we mentioned, the area around the eye is very sensitive. So I would avoid that.
It's become a regular thing to use contact lenses, not just for vision correction, but also for aesthetics. Tell us a little bit more about colored contact lenses.
So contact lenses, again, I would say it's a boon to many people because, having to have this hassle of wearing spectacles for every single thing. But then if you can handle it with care, again, because contact lenses are something which sit, again, right on your cornea. So it's in direct contact with the most precious part of your eye through which light enters. And they all have a time frame. You have daily disposables, weekly, bi-weekly, monthly, and it goes on. And colored contact lenses are something which a lot of people try on for weddings and functions. There's nothing wrong with it. It's just like a regular contact lens. It just has a tint. And but again, with regards to every contact lens, please do not sleep with your contact lens on. Even if you feel that it's a small nap for 10 minutes, please do not sleep with your contacts. Because the infections which come because of contact lens is really, really serious. Most of them are these gram-negative infections and very aggressive infections. And you might take it light that, okay, I just slept for 2 hours, it's not a big deal. But, sometimes if something goes wrong, then you lose your vision. You might end up like needing a transplant. It goes to that level. So contact lenses with caution.
Guilty of having slept with the contact lenses on once, only 25 years back, so not any time now. But then when I woke up, I had the best feeling of my life. I really thought that I had woken up and got my vision back. That happened much later with LASIK though.
Okay.
That was the feeling that was there after the surgery. I think I underwent it in my early 20s.
Okay.
Please tell me a little bit more about what's new. How long can we stay on? How long can we be on contact lenses? Or when is a good time to consider a LASIK surgery?
18 years, I would say, is somewhere where you would start considering LASIK surgery. 18 years, provided your power has remained stable and because your eyeball keeps growing. So until that happens, then the power keeps fluctuating. So only when it is stable for a year, then you would consider getting a LASIK surgery done. And before you get a LASIK surgery done, obviously you visit the ophthalmologist, you get a series of scans, and only if you're suitable, you will be advised for laser. And I think when you got your LASIK done, probably it was a flap-based procedure.
Is the photo? I think I didn't qualify for LASIK. I went for this photo refractive keratectomy.
Yeah. So there are different types of LASIK surgeries. You have something called as a PRK, which you have gone, and then there is a LASIK. You have femto LASIK, and now you have the latest, which is called as a Smile Pro. So how it has evolved is initially we used to use a flap-based procedure. We use an instrument to cut a flap, lift the flap, apply the laser, do the correction. Now there is no flap because these flaps they can dislodge even after 20 to 30 years. If there is a major trauma to the eye.
No, I shan't relax.
Yes. No, you had a PRK, so there's no flap.
Okay.
There is no flap there, so you're safe. So flaps, I'm not saying they dislodge just by rubbing eyes or anything. It's like if it's a major trauma to the eye.
Like an airbag, for example, would you say?
Airbag, yeah. Most of them, these tennis balls, shuttlecock injuries, playing sports. So that's why for people who play sports, we typically tell them not to go for a flap-based procedure.
Okay.
Because you never, and combat sports or anything for that matter. So for them, PRK, what you had gotten done is easier because they just remove the epithelium, correct the power, and then the epithelium grows back. So there's no flap, there's nothing to dislodge there. And the latest we have is Smile Pro, which is a lenticule-based surgery. So what we do in LASIK is basically you're working on your cornea, which I mentioned. So you're trying to change the shape of the cornea. You're trying to flatten it. it's like a dome. You're trying to flatten it in the center for you to get the power correction. So you can either flatten it by lifting a flap, applying the laser, putting the flap back, or you can remove the layers in a lenticule format.
Okay.
So yeah, I'm not making a big incision. It's just a 2 millimeter incision in your cornea.
Okay.
And then the laser, according to whatever power you have, it does the power correction on your eye and it separates the layers. So if you look at the cornea, you have 6 layers. So the laser can actually separate the layers. So
Okay.
we work on a part called as a stroma. So you remove if 10 microns or 12 microns or 50 microns. The laser makes the cut. We go in and we remove the lenticule out. So that's a lenticule based procedure. So there's no major flap, there's no big cut. So there's no...
And the advantages?
One is the laser time is much faster. It's hardly 9 seconds.
Huh.
Yeah, it's 9 seconds. So I've had patients asking me like,
when are you starting the procedure?
Did you even do the surgery? We were like, yes, we're done. So it's that fast. And and the healing time is also faster because there's no big incision. There is no need for a contact lens or anything of that sort. So technology has advanced and Smile Pro is the latest for us.
Fantastic. What are the precautions in terms of a hair wash? When can I resume washing my hair after LASIK? Because usually what happens is, if somebody is undergoing a procedure for the eye, corrective surgery for the eye, they stop, of course, they stop internal medications depending upon what you want. But at the same time, they also stops hair care, skin care for a while.
Yes.
When is it safe for us to say, okay, you can go back to your routine now? First in terms of hair wash, and then in terms of products to be applied around the eye.
So like you mentioned, hair wash and face wash, we would avoid for a week. Yeah, but hair wash can be done in a parlor, provided nothing goes into your eye, and you can
As
get
early
it done.
as
2 days.
2 days?
Yeah,
Okay.
yeah, you can get it done in a parlor. Products, moisturizers are fine after a week, I would say.
Okay.
But any other skin ointments or actives which you
Sunscreens.
get.
When do we start sunscreens
you
after?
can start sunscreen in a week, not a problem. Only thing is, I would say avoid the area around your
the eye.
eye because you never know. Sometimes if it accidentally gets in,
Yeah.
we want to avoid that.
So in short, nothing that can potentially cause an allergy or an irritation around the eye, at least for the first critical period of 1 week. What about when can we get back to swimming, or when can we get back to active physical activity?
So physical activity, I would say if you want to walk, then that should be okay even on day 1. But day 1 post surgery, you're in a little pain and discomfort, so better to rest it. And you could walk in a clean zone if it's just your apartment building, the bottom. But wear protective goggles. Protective goggles have to be worn at least for a month.
Okay.
And for a week, I would say throughout the day and night as well. But after a week, when you come for your first checkup and everything is good, then the goggles, you don't have to wear it when you're in a clean space in your house. But when you step out, I want you to wear some protective glasses. And walking can happen. I would say gym and weightlifting and all those exercises maybe after 2 weeks.
Okay.
Not that you can't. I feel you're exposing yourself to a crowded environment, a chance for you to pick up infections, because in gym we all use chalk while we're lifting weights, and the powder gets into your eye and you're touching the barbell which someone else has touched. It's more like an infection part which I'm trying to avoid there. And so give it maybe 2-3 weeks and you can get back to all your activities. Not going into the beach, swimming, water sports, I would say at least a month. I'm just being extra cautious here, that's all. And swimming, definitely with goggles always. Even if you have not done LASIK, please use goggles, because swimming pool water is prone for infections, and we get a very serious acanthamoeba infection which causes ulcers and loss of sight. So definitely goggles.
So we spoke about what's the lowest age limit to get into LASIK surgery or to consider LASIK surgery, and what would be the highest after which you say it wouldn't make sense for me to operate on you because you're this many years old. Okay. What is that age limit?
So the reason why we say 18 and above and below 40. is because that's when you enjoy the maximum spectacle freedom. Okay, the whole point of LASIK is you don't have to use glasses for anything. And after 40, because of age-related changes, you have a condition called presbyopia, where the muscles in your eye tend to work a little slower, and we all end up needing reading glasses. So when
You are deeply felt here.
yes, we're always carrying our reading glasses around, and the minute you notice you're pushing your phone or your book a little further away, that's the time you know you need reading glasses. So beyond 40, the LASIK procedure just corrects your distance power as of now, and the results are great for that surgery. And so post 40, even if you've corrected your distance power for reading, you need to wear glasses. Although there are options called as a monovision LASIK, where I correct one eye for distance and I undercorrect the other eye, where you'll be able to manage without glasses. That requires a more detailed evaluation of the patient, and patient expectations have to be set right before they opt for the surgery.
But it's okay to have one eye having a different power and the other eye having a different power.
So we will
intentionally
yes,
also.
it's
Okay.
done on purpose because they don't want to wear glasses and they're above 40. So then we do this monovision LASIK. The one eye is for distance correction and one eye is undercorrected. It's not that I don't correct it, I would correct half the power or whatever. And so your eyes balance, you're able to see distance and you're able to read. But then it needs a lot of explanation to the patient about what to expect after surgery. Because and all patients post LASIK have this tendency to close one eye and the other eye and compare and see which sees better. So that is something which we need to avoid.
One of the things that we feel that we have a higher incidence or higher amount of people, higher number of people coming in with visual issues, higher number of people coming in with a difficulty to see like they usually should do or could do, be it in the youngsters, be it in an older age. What do you see as external or lifestyle factors that contribute to it?
So I think the most common thing nowadays is digital eye strain and dry eyes. This is something which we've started noticing even amongst children.
As young as?
I would say even 8 years, 5 years, 6 years, because they're always with their gadgets and they are in a closed space. They are not playing outdoors. There's no exposure to sun. So digital eye strain is something I have a lot of patients across all age groups walking in for that. So we'll have to educate them on how to use your screen time more efficiently and how to use your lubricants and how to avoid further damage to the eye.
Is there a technique that you use, considering that all of us are at some level tied to work using digital screens? Is there a technique or anything that can help to make things better? Because we tell the children to study better or like work harder at whatever, and everything happens to be on a screen. If you were to give me a step-by-step plan as to how to get out of or how to mitigate digital eye strain, can you give us like a protocol or a game plan?
So first and foremost is we ask the patient how many hours they spend in front of your system, if it's 8 to 12 hours or something. And so what you could do, I think you've all heard of the famous 20-20-20 rule. And so for every 20 minutes, I would say take a break from your monitor and look at an object which is 20 feet away. And the whole point being is when you're looking at a screen, your eye muscles are focusing at a near object. And having said that, your eye muscles are weak after a point when you're doing the same thing over and over again and you start developing this eye strain. So to relax that, you have to change your focus from a near object, you look at a distant object. So that's when you relax your muscles. And blinking is something which I would encourage patients to do consciously. Normally we all blink. It's a subconscious thing which happens. But when you're looking at a screen, you tend to keep your eyes more wide open and you're not blinking. So every time you blink, a new tear film forms. So by not blinking, whatever existing tear film is there, it evaporates and there's nothing new coming there. So blink more often while you're looking at a screen, take frequent breaks, and if you're sitting in air-conditioned environment, which most of us are, make sure the AC, the fan or nothing is directed towards your face. Everything from behind, so nothing towards your face, because again that evaporates the tears. The other thing would be maybe a palming exercise, which it's more for relief. I wouldn't say it's going to take away digital eye strain, but rub your palms together, just a little warmth, and just place them over your eyes for a couple of seconds, and you could rotate your eyes, right and left, up and down, just to relax the muscles.
Overall limit digital time.
Okay.
Or overall limit screen time. No.
I would be very, I would say 4 hours, but then I don't think it happens. So I would say
Is it
8 to
the
10
cutoff 4
hours. 4 hours over a day if you can spread it out, but I'm sure that's never going to happen.
Yeah,
that's never going to happen. So there is no cutoff. It's more like the less time you spend, the better. And you do have this blue light filters on screens, and you could put your screen on a dark mode or a night mode where the contrast or the brightness is not too much. And I think most of the laptops, they come with the blue light filter, and you could use blue light filter glasses. It's not going to negate the entire problem, but at least limit the exposure to blue light. So
how effective are they?
That's what. So if it's not that I wear blue light filter and I can look at the monitor for 20 hours. No, that it doesn't work like
it's
that.
It's like sunscreen. It's like the Caucasians did. I can wear sunscreen and go out to the sun for whatever time I want, and I ended up with having higher rates of skin cancer because they did not account for the fact that even sunscreens work only this far.
Exactly. Yeah. So blue light works only to a certain extent. So don't overuse or abuse your blue light glasses just because you think they're safe. So that's something you shouldn't do, but it helps to reduce eye strain to a certain extent. So you can try them on.
So the glasses that reduce eye strain, are they particularly working only on blocking out blue light, or do they have any other inherent abilities?
So primarily it's blue light, and you also have anti-glare glasses. So that is also something which you could get.
What does glare do to?
So glare, again, from a bright screen, or when you're driving on a road, there's too much of glare from the sun and from the road, those kind of things. So I would say these two coatings on a glass, and definitely when you go out in the sun, UV protection is a definite must. And I think everybody should invest in a good pair of UV protective sunglasses.
We were just going towards asking you about these reels that keep surfacing on and off saying that sunglasses are the worst things that you could do to your eyes. And then we see on the other side that you need to protect, need to use UV protective glasses, not just for the corneal health, but also for the lens. Can you tell us, are we as a country more prone to cataract, occurrence of cataract because of sun exposure? So, and will sunglasses help?
Cataract, again, like I mentioned, it's an aging process.
Okay.
So that doesn't mean that I wear sunglasses and I will never get cataract. That is not going to happen. You will get it, but at least you're delaying the progress. And the sun's UV rays definitely are harmful. You develop a cataract, you develop a macular degeneration, and you develop these fleshy growths on your eye, which is called as a pterygium, which is again because of sun bouncing off your nose and entering your eye. So that angle in which it enters. So that's why it typically comes in the nasal part of your eye there. It's a fleshy growth, and cataract, like I mentioned. So sun protection, again, because like I said, the skin around the eye is also very delicate. So again, to protect that area.
Despite having such a high UV index, why do our people generally not wear sunglasses?
So I think we'll have to educate them on the use of sunglasses, and it actually helps them, and to invest in a good pair of sunglasses, because the problem with most of the sunglasses, and also the frame has to be a little wider to cover a larger zone, not the narrow ones.
Like an aviator or a wayfarer style.
So I would prefer something which covers more area, and a lot of people don't understand the importance of sunglasses. They think it's a fashion statement, or fancy glasses, and they don't
people judge each other for wearing or not
exactly. So and you'll have to check whether your particular glass has 100% UV protection, because most of the glasses are tinted. They have a tint, but they might not have a UV protection. So then what happens if you wear the glasses without the UV protection? You're looking through, so it's dark. So when it is dark, your pupil dilates a little more to allow more light to enter. So it's counterproductive that you're putting something dark across and your pupil is dilating more to see, and there's more sunlight entering your eye. So that's why I would say maybe in exhibitions or places like that, you see parents getting kids these fancy, cute glasses. So I would encourage them not to buy those glasses for their kids because the kids don't know.
And they'll stare at the sun through them.
Yes,
Okay.
they stare at the sun through them. It's not giving any UV protection. It's a dark surface. It's allowing the pupil to become wider. There's more sunlight, there's more damage.
For adults, we check. For adults, we think that it has to serve us in the long run. For kids, it's just a use and throw. Ones that mostly have cute frames.
Correct. Correct.
Matches
So
clothes. Those kind of kind of things.
So
right.
we will have to look for kids. I think by 3 years, whenever they're fancy and they want to wear a sunglass and go out, definitely, or at least a wide brimmed hat or something to protect from the direct sun rays.
Yeah.
And
Fully
definitely
approved by dermatology.
Yes. So those two things, go hand in hand. Like how I tell my patients, please apply your sunscreen. So you can tell them, please wear your sunglasses with UV protection.
Yeah. So when these reels come up with this level of misinformation that they ask people to not wear sunglasses, especially not being mindful of how much UV we have here as a tropical country.
Yeah.
Maybe for another country which has much less UV incidentally, it may be easier or to give an advice or saying like I go out in the sunlight for X number of hours. But for us it's already, you come out of your bedroom and into the living, it's already well lit, hopefully in most homes.
Totally.
So,
and even on rainy days, like how you suggest sunscreen on rainy days, I would say sunglasses, but if it's too rainy and you can't look at the road, then obviously no. That's even more dangerous, but sunglasses are a must.
I had a very interesting anecdote. When I was younger, there was a point where I was put on glasses and my myopia was increasing year on year. So I read this book which talked about staring at the sun directly after, right after I had gone for a consultation and came back, my power had jumped. I was upset. Then I was looking at this book from somewhere, I think from my ophthalmologist office or somewhere, I don't remember where. And it said you could every day go out in the sun, practice moving your head and staring at the sun. So I was well dilated pupils.
Oh God.
I went directly, stared at the sun, and then I think I damaged something.
I hope there's no permanent damage there.
I had to go back to the hospital because I think I had intense eye pain after that. And that's probably...
you get something called as a photokeratitis. So
please tell us more.
So it's basically when you're exposed to too much of sunlight, or sometimes when you're in a snowy place and the light reflects off that.
Equivalent of a sunburn, but in the eyes.
Yeah, so it can damage your cornea. It can cause dry spots and damage there, and you'll have a lot of photosensitivity. You'll not be able to look at light. You have to medicate yourself to get out of it. So definitely no looking at sun.
We spoke about the tear film. And we just discussed that it could kind of get compromised by staring at gadgets for very long. It could also get compromised by using different kinds of makeup, as we just discussed, especially the fake lashes and all of the aesthetic procedures that we use around the eye. How important is this tear film? We also spoke about the massage. Can you tell us what do we do naturally, or do we do anything naturally to improve this tear film? Because it seems like a protective response, very crucial protective response. Can you tell us more?
So your tear film again is like a barrier mechanism. So like how you have your eyelids and your eyelashes, and all of them are like, it's a reflex. So anything coming close, you close your eyes, and so that's how the reflex acts. So your eyelashes actually take out, filter out any foreign body entering your eye and things, dust or something. So your tear film is the next layer any object comes in contact with. Your lids, then your lashes, and you have your tear film. And below your tear film is your cornea and all the structures. So you have 3 layers in your tear film. You have the lipid layer, which is secreted by the glands in your eyelid. And what it does, it's an oily layer, so it prevents the tears from evaporating faster. Then you have an aqueous layer, which is the bulk of the tear film, which is produced by your lacrimal gland. And then you have a mucin layer. It's basically it's on your cornea. It helps to attach the aqueous layer to your cornea. So there are 3 layers there. And if you look at a normal, so your tear film has antimicrobial agents, it has immunoglobulins, it has salt, that's why it's a little salty when you taste
cry.
your tears, and it has lysozymes and antibacterial enzymes. So they break anything which enters your eye and act as a first line of defense for you. And so why does your tear film break up is because of dryness. So evaporative dry eyes is very, very common. And then you have an aqueous deficient dry eye, which is not so common. And aqueous deficient is where the tear production itself is less. Evaporative is where it's produced, but it just dries away and you have to regenerate faster. And evaporative is again typically because of your digital eye strain, your AC blower in front. And when you ride a two-wheeler, I tell my patients to always wear a visor or some goggles which cover the entire side, because anything, the air evaporates and the small insects and everything which falls into the eye, and that causes a lot of problem. And so why does a tear film break up? Again, is because of less blinking, or you have makeup products entering your eye, and a lot of them, they use a powder kind of thing on the eye, and they don't realize that a layer of it is going into your eye even without your knowledge, and
Setting powders and
stuff. Yes, so that kind of settles on your tear film, and the minute there is some foreign particle over there, it starts breaking up faster. It's not a smooth surface, so something is entering and your tear film starts breaking out. So that's when you have more of a foreign body sensation and everything. So use the products more cautiously, I would say. Nothing entering your eye. And if you're someone who uses contact lenses, then maybe put them at the end and take them out first before you remove
after
the makeup.
The contact lenses go in last.
Yes.
And they get removed first.
Yes.
Okay. So one of the mistakes that at least I've been making in the past, and I also see people make, is because we want to be able to see the makeup properly.
Oh,
We
okay.
have to get the contact lenses first.
Okay.
So we can see where exactly we are doing the eye, where exactly we are lining the eye.
Okay.
So, okay, but then the contacts go in.
The usual norm is put it like this, because then you don't have anything falling. And I feel that sometimes even with the mascara brush or the sometimes we accidentally touch the
Yes.
eye.
Yes.
It's happened a lot of times. So you
Yes.
touch the eye, and then in a reflex you move, and then there's irritation and the whole process.
Yeah.
And no leaky products, like anything which can enter your eye, like if it's a liquid kind of eyeliner, I don't know, but use it cautiously.
Yes. What is a good way to blink to keep this tear film happy?
Okay, so a complete blink,
Yes.
the entire eye blinks. So that is when your pump mechanism operates well. So normally we do blink, maybe in an hour, I would say close to 1,000 times. Naturally, it happens. But if you were to consciously blink, then it has to be a complete blink. So both your lids should touch each other and come out, not like a partial. This is not a blink. So a complete closed blink, that would be better.
And that would be part of an exercise that we can do to reduce eye strain?
You could do.
Is it okay
You could
to do
it.
something like that? We discussed that for a skincare routine. It's quite common. The discussion is there, the reels there. There's a lot of information. All of us are putting out too much information at times. But for the eye, you said that you only see people when they have a problem. Is there a role for a regular eye checkup? Like at 40, we go for a mammo, or we go for a pap smear. Like at least for the women, it is there. At least we go for cardiovascular health, look at ECG, echo every now and then. There's a structure to how it should be done. But for the eyes, is there a set way that we have to look after our eyes?
So for that, I'd like to classify as a pediatric age group and an adult age group. So for kids, the one common thing people miss out is your kid can't say which is good vision. So most of the time you see them not performing well in class, or they come closer to the TV, they're squinting their eyes, they're tilting their head. These are all indications which as a parent or as a teacher you can pick up that the kid is not able to see well with that eye, because they've seen only that and they don't know there's something better than that. So ideally, I would say at 3 years of age, if you're able to bring them in for an eye checkup, and then at least at 5 years before they start school, they have to have an eye checkup. And every year, because for kids, if they have a family history again of parents being myopes, then the chances of the kid also being myopic is a little high. And there is a lot of genetic conditions which you need to rule out also. And so at 5 years, you bring them for an eye checkup. If everything is good, no need for glasses, then maybe every year I would suggest for children for eye checkup. And because there is something called as an amblyopia, which is a lazy eye, which if not corrected early, then when they are 14 or 15, I'm not able to do much there, because the signals are set and there's nothing done to reverse the process. And so when you pick it up early and you do this eye patching and treatments, you're able to reverse the entire process. When you come to adults, so assuming that you're in your 20s or something, I would say maybe once in 2 years. If you have no issues, if you don't have a refractive error and you're comfortable and everything is good, once in 2 years a regular eye checkup. And maybe 40, I would say once a year after 40, because we all end up needing reading glasses and things like that, once a year. And but if you have a strong family history of glaucoma or conditions like that, which again runs in family, even if you're 20, I would say come in early and get your eye pressure checked, because that is something which if you miss out, it's probably called as a silent thief for that reason, because you don't realize what's happening. And I had a patient recently who kept tripping and falling and not realizing he had a problem with his eyesight. And then when we checked, he had glaucoma and it was in an advanced stage. So once a nerve is damaged, there's nothing much I can do to reverse it. Your eye pressure increases, the pressure in the eye. That's different from the blood pressure. A lot of people, when I ask them eye pressure irka, they'll say BP illa enakku. So BP is different, eye pressure is different. So it runs in families. So please get yourself checked if you know a grandparent or a father having glaucoma. And don't wait until you're 40. It can come even when you're 20s and 30s. So get checked then. If everything is good, yearly once. But if you're diabetic or hypertensive, then maybe once in 6 months.
Okay.
Because diabetic changes happen in the retina. You have small bleeding spots. And if you miss out the early stage, then there will be a sudden drop in vision where, there's an extensive bleed. So you don't want that to happen.
Would it make sense that if someone has received a diagnosis of diabetes, would eye checkup be one of the first things they've got to do?
Yeah. If you have been diagnosed with diabetes, I think get your eye checkup done first. And by eye checkup, I don't mean only the glass prescription. You will have to dilate and take a look at your retina. Don't make it a habit to visit optical stores every time to get your power check done. You have to visit an ophthalmologist to make sure that, everything else is right. And then just for the prescriptions, you could always go there. I understand the ease of doing that and not coming to a hospital to visit a doctor. But you might be missing out something in the early stage if you're not visiting your ophthalmologist.
Because it's not just about the
It's not only about the power, because that's just one part of it. You have so many other things. It might seem like a small organ, but there are a lot of layers inside. Each one has a specialty. So you will have to get yourself checked. And maybe if you break your glasses in between within a year, and your checkup is fine, then you can go and exchange glasses. But don't go only there for your eye checkups.
I have been made to eat a lot of vegetables on the pretext, sometimes the threat, that they are directly helpful for the eye. How true is that? I think initially they started out with carrots and then it moved to whatever vegetable I refused to eat. It was supposed to be good for eyes, so I ended up getting forced to eat all of it, which is a good thing. But if you were to say 5 food items that will really make your eyes happy, what are they?
So again, I would say eating these food items alone is not going to solve all your problems, because they are like an additive thing, like how we eat good food for good skin and hair, like how you say. So it's the same thing for eyes. Carrots, yeah, because any vitamin A related content like sweet potatoes, carrot, colored capsicums, and spinach, we say. And I would say omega-3 fatty acids really play a role more than carrots, because, for the meibomian gland secretions and everything, we advise people to take more of omega-3 supplements. If they eat fish, great. Otherwise, seeds and nuts, which have the omega-3 fatty acid in them. And we do have supplements again for the macula, primarily like containing lutein, zeaxanthin and everything. But overall, eating carrots, spinach, seeds, omega-3 fatty acids containing fish and everything is good for the eye.
So carrots are indeed good.
It is good. It doesn't mean that my kid has been eating carrots and why is she wearing glasses. So it doesn't work like that.
Okay.
For a general nutrition standpoint, it is good. Yeah. It's not directly related to, the health of your eye. Yeah. I wouldn't say somebody who eats so many carrots is going to do good than someone who doesn't.
Anything about tomatoes?
Like I said, anything which is good for the body.
Polyphenols and proanthocyanidins and stuff. We'll quickly get into a rapid fire round, Doc. You can answer with a yes or no.
Okay.
Is it okay to apply kajal to newborn babies?
Definitely no. I wouldn't advise anything for kids because they have this habit of putting everything into their mouth. I also feel that if you touch and then it goes into their mouth and it can block the glands. So definitely no for
Yeah.
kids.
And we're also very mindful of the amount of lead content,
Yeah.
especially from homemade kajal
Okay.
or non-branded kajal types also. There's a common myth that natural or Ayurvedic products are generally safer on the eyes, and whatever you can eat can also be put on the skin and therefore into the eyes or around the eyes.
I would stay with things away from my eye because it's a very sensitive organ and you really don't know what happens in these Ayurvedic products. You don't know what the content is not very clear. A lot of them use these Ayurvedic eye drops. I would suggest no.
Is it okay to look at the solar eclipse directly?
It's not even okay to look at the normal sunlight, leave alone a solar eclipse. Definitely no. It can cause something called as a solar retinopathy, where it causes a damage directly to your macula, which is the area which the light focuses and you're able to see. And if it's a permanent thing, it's a scar, and you will have vision issues then.
We will leave you with an interesting one. Twitching of the eyes, is it a good omen or a bad omen?
There's definitely no omen related there. It's because you're stressed and you've been watching too much of gadgets or too much caffeine, and it just goes away by itself. If it's still persisting, then you can visit your doctor.
So, Doc, we put together a list of factors after your discussion as to what influences eye health. Now, you've got to stack it in terms of significance, which is the most significant factor that influences eye health. Could be an exposome factor, could be a genetic factor, could be anything. And tell us what is the, and do arrange these stones in order of significance.
Okay.
Now tell me why you picked these factors in this order, Doc.
So a lot of them think that genetics plays an important role, but we forget that even with bad genetics, with a good lifestyle and nutrition, we can overcome that. So never blame it on your genes always.
Now that
and
we
get
have
away with
exposomes in
things.
the
Yes, so we have enough of that around us, and so that's why I've put lifestyle as the first thing, and nutrition as the second most important thing, and aging is something because an eye is a structure where like any other organ, it as you age there are changes happening in your lens, your retina, your accommodation, so a lot of factors, and that is why we insist on annual eye checkups and frequent eye checkups. Digital eye strain, which is something which all of us face in this day and age, and that is something which we should consciously try and decrease, if not at least take measures to keep our eyes a little better. Sun protection is a very underrated thing in ophthalmology. A lot of people don't understand the importance of sun protection, and I would like to stress to people to please wear sunglasses whenever you step out in the sun. And I would put genetics as the last and the least important. I know it is important, but in this day and age, these are the other factors which you can focus on before blaming it on genetics.
I think there's very little that you can go back and do anything to change the way the eyes are, because the genetic factors seem to be set in stone and there isn't a lot of scope to work around it. But what I liked also is the fact that you differentiated lifestyle in general and then highlighted certain other factors. So we could say that even wearing sunglasses or eye strain is also part of lifestyle. But the important aspect is that these are big factors for ophthalmology. These are big factors for eye health and need to be given a separate, clear place. Well understood. Thank you so much, Dr. Preethi, for joining us today and exploring the eye exposome with us. And this is a very interesting topic. And so if you have more questions around this, put them down in the comments and we'll discuss. I'll see you soon and you take care.